Welcome to the Deep Dive. We're here to break down complex research, overwhelming data sometimes, and maybe even some revolutionary ideas, and really distill them into something understandable, something essential.
And today we're tackling something that sounds almost mundane, the kitchen.
Right. But as our sources argue, and this is what's fascinating, this very basic space, the kitchen, might actually hold the key to, well, national health, social equality, even cultural survival.
It seems like a huge claim, doesn't it?
Yeah.
But the research we're looking at today makes a compelling case. It suggests that the path entire nations take their health, their social fabric, their stability. It's fundamentally tied to whether that stove is lit, and critically, who is standing there.
Absolutely. And for this deep dive, we're setting up a really interesting contrast. We'll look at the historical shift in the United States, sort of as a cautionary tale.
A data-driven one.
Exactly. And juxtapose that with the immediate, almost escalating crisis we see in emerging economies, with a particular focus on data coming out of India.
But here's the crucial part of our mission today, right? We're not here just to, dwell on the negative stats.
No, definitely not. The goal is to extract those urgent warnings, yes, but much more importantly, to focus on the positive, the progressive, the genuinely revolutionary solutions being proposed. Solutions to build a stronger, healthier, and much more equal future for families and really for society as a whole.
We're deliberately approaching this with optimism. This isn't just looking back. It's about building a blueprint for resilience, proactively. We think the real progress comes from seeing the danger clearly, but then immediately pivoting to solutions that foster dignity and, crucially, shared responsibility.
Okay, so let's get into it. Can lighting a stove, that simple daily act, preparing a meal, can that truly be revolutionary?
The argument we're exploring says yes, emphatically yes.
We're going to make that case using the evidence from these sources, that it might just be the most accessible, high-impact revolution available to every single one of us right now. So let's start with those lessons. Maybe learn the hard way. First, we really need to look back at that dramatic cultural shift in the United States. And again, the aim here isn't judgment, not at all.
No, it's about understanding the pattern. It serves as a crucial, data-driven predictive model.
Exactly. If you want a glimpse into the potential future of a society that prioritizes convenience over connection, well, the U.S. experience over the last few decades gives us some incredibly clear, frankly, quite stark data points.
The contrast is, well, it's massive.
Yeah.
If you rewind to, say, the 1970s, the family structure itself was fundamentally different. The sources paint this picture of multi-generational homes being much more common.
And that wasn't just about living space, was it?
Not at all. It was a whole structure of shared resources, emotional support, financial help, caregiving, grandparents, parents, kids, often living together or, incredibly close by. They had daily shared routines.
And the heart of that whole dynamic, unquestionably, the kitchen.
Absolutely. Every evening, families gathered. Meals were home-cooked, not ordered in, not microwaved from a box.
And this wasn't just about feeding people, right? It was the mechanism for, well, everything else, culture, values.
Precisely. The shared act of preparing food and then eating it together, that was the primary source of bonding. It was the time for passing on values, traditions, stories, recipes. The family heritage, the kitchen was like the furnace keeping the family unit warm and connected, culturally vibrant.
But then, around the 80s, things started to shift, and fast.
Yeah, economics played a huge role, didn't it? And this burgeoning convenience culture, inflation, cost of living increases. Suddenly, two incomes weren't a luxury. They were often a necessity.
Which meant less time, right? Less time for those daily rituals like cooking complex meals from scratch. Convenience shifted from being nice to have to feeling like a lifeline, born out of sheer exhaustion for many.
Exactly. And the market, well, it responded almost instantly. You saw this incredible surge, fast food chains popping up everywhere, quick takeaway places, the industrialization of processed packaged meals filling supermarket shelves.
That convenience factor was, let's be honest, incredibly appealing, addictive even. But the sources really hammer home the hidden cost, this outsourcing of fundamental responsibility.
As parents got busier juggling jobs, commutes, school runs, just the escalating demands of modern life, that reliance on quick fixes just skyrocketed.
And kids. They started relying on those standardized processed meals, pizza, burgers, microwave dinners, replacing not just the nutrition, but also those social benefits of eating a varied home-cooked communal meal.
And this outsourcing, it wasn't just about food. It had these really profound emotional and relational consequences. Consequences we're still grappling with today in terms of mental health crises.
Yeah, the sources use this really poignant phrase that the voices of grandparents dimmed.
It's powerful, isn't it? They lost that vital, functional role within the immediate family transmitting culture, providing care. Family routines just dissolved.
That shared ritual of cooking and eating together faded. And with it, you saw these emotional distances growing, even between people living under the same roof. They were sort of existing in parallel lives, often mediated by screens, rather than connecting over a shared task and meal.
And look, the warnings were there. This wasn't some unforeseeable outcome. Experts were cautioning, quite explicitly. If you outsource your kitchen to corporations and family care to governments, families will fall apart.
A stark warning, really stark, about the danger of commercializing the most basic, intimate parts of being human nourishment and care.
The tragedy really is that the data backs up those warnings with brutal clarity. When you look at the specific collapse of what was considered the traditional family unit in the U.S., the numbers are nothing short of a sociological catastrophe.
So back in 1971, what was the figure?
In 1971, a clear majority, 71% of American homes, contained that traditional family structure. Parents and children living together.
Okay, 71%. And today?
Today. It's down to just 20%.
20%. Just think about that scale of change.
I do.
In roughly half a century, it's staggering.
It's a profound disintegration. And the societal fallout is the isolation we see so much of today. Elderly people often separated from families in care homes, young adults starting out alone in rented flats, rising rates of broken marriages, and kids battling this pervasive loneliness because those fundamental structures of shared life, shared purpose, they've just eroded.
Those everyday connection points that shared work, like cooking and shared meals, provide. They're just not there in the same way.
Exactly. And this fragmentation, this loneliness, it's intrinsically tied to the public health disaster that followed. This is our clearest predictive model.
Right. When the family stops cooking regularly, nutrition quality almost inevitably plummets. Because corporate convenience food is designed for profit, for shelf life, not primarily for optimal health or freshness.
And the health statistics are, frankly, a public health emergency. 73%. Think about that. 73% of U.S. adults are now classified as overweight or obese combined.
And if you drill down into clinical obesity,
For 2021 to 2023, the figure was 40.3% of adults categorized as obese, and severe obesity. That affected 9.4%.
that represents an immense number of people suffering with diet-related chronic illness. And this is the crucial link the sources make, right? This collapse in home cooking is the engine driving this massive, unprecedented surge in chronic conditions.
Absolutely. We're talking diabetes, hypertension, severe heart disease, increasing rates of certain cancers,
Yeah.
conditions that were once considered, diseases of old age.
Yeah, relatively rare, or
Yeah.
primarily affecting the elderly.
Exactly. And now, they're commonly diagnosed in people in their 30s, even their 20s sometimes. It's a health disaster, essentially created by a structural, cultural vacuum.
So the U.S. experience gives us these really clear data points. The decline of the family structure and the simultaneous collapse of public health, they're like two sides of the same coin. The coin of an outsourced life.
Yeah, the time supposedly saved by convenience wasn't reinvested in connection or well-being. It got swallowed up by economic pressures, leaving society, well, weaker and sicker.
But the crucial transition now, and this is where the optimism has to come in, is looking at the emerging crisis elsewhere. The U.S. had decades for this decline to unfold. Many emerging economies are facing this same pattern, but in hyperspeed.
That acceleration is the key difference.
Yeah.
And it makes the need for proactive solutions even more urgent.
Right. If the U.S. timeline was decades, the current crisis elsewhere demands immediate intervention, which is precisely why this progressive solution we're going to discuss is so vital. It's about getting ahead of the curve this time.
Okay, so if the U.S. was like the slow-motion warning film playing out over decades,
Yeah.
then the statistics coming out of places like India right now, they're the immediate flashing red lights, sirens blaring, really. They demand intervention.
This is the immediate justification for what our sources call that revolutionary adjustment, because it's not some distant threat on the horizon.
No, it's happening now. It's a present reality that requires a positive, forward-looking intervention today.
Let's lay out those numbers because they really do underscore the urgency. The scale of the health crisis is immense. It signals that this trend of social outsourcing, especially around food, is already taking a devastating toll.
Okay, start with perhaps the most alarming one, diabetes. India currently has over 101 million people diagnosed with diabetes.
101 million. That number is just Hard to comprehend.
It is. It translates to about 11.4% of the entire population. And compounding that metabolic stress, 35.5% over a third of the population suffers from hypertension, high blood pressure.
Wow. So if you combine just those two,
Mhm.
diabetes and hypertension, you're looking at nearly half the adult population grappling with serious chronic diet and lifestyle-related conditions.
Precisely. And the shift away from traditional, often balanced, plant-rich, home-cooked meals. It's terrifyingly clear in the obesity data.
What are the figures there?
Our sources indicate 28.6% of the population are now clinically classified as obese.
Nearly 30%.
But, and this is where we need to get a bit technical, but it's crucial for understanding the severity. Perhaps even more alarming than the general obesity rate is the figure for abdominal obesity.
Fat around the midsection.
Exactly. 39.5%, almost 40%, have abdominal obesity. And this is critical because that type of fat, visceral fat, is highly metabolically active. It's not just about appearance.
It's a major health risk indicator.
A huge one. It's a key component of metabolic syndrome, that cluster of conditions like high blood pressure, high blood sugar, unhealthy cholesterol levels, and excess waist fat. And metabolic syndrome massively increases the risk of severe chronic diseases like heart disease, stroke, and type 2 diabetes.
Yeah.
This isn't just cosmetic. It points to a systemic breakdown in metabolic health.
And the final piece of this alarming health picture.
High cholesterol. It affects nearly a quarter of the population, around 24%.
Okay, so let's put that all together. Diabetes over 11%, hypertension over 35%, obesity nearly 29%, abdominal obesity almost 40%, high cholesterol at 24%.
When you stack those numbers up, you're looking at a nation where foundational public health is eroding at an incredibly rapid pace.
Yeah.
It's mirroring the exact trajectory the U.S. took.
That happening much faster.
Much faster.
If we apply the core lesson from the U.S. data, these staggering health numbers are a direct signal of a much deeper sociological shift. This trajectory is fundamentally unsustainable economically, culturally, from a public health perspective, unless a systemic change happens right back where it started.
In the kitchen.
In the kitchen. If the crisis, both health and social, is driven by abandoning the kitchen,
Then the solution must originate there too. The diagnosis is clear, the warning signs are flashing. Now is the moment for that progressive pivot. Time for the proposed and frankly absolutely necessary solution. We need to reclaim that space.
not as a burden, but as an act of resistance, an act of building a better future. Okay, so this is where we shift gears completely, into the proactive, the optimistic vision, focusing squarely on the future we can build. And the core progressive argument here is this proposed positive adjustment. Our sources are very explicit. They call this progress. They call it revolutionary.
It's about intentionally building a better, stronger foundation together.
And the very first step, the non-negotiable starting point for this future, it's challenging those outdated, completely unsustainable traditional roles.
For far too long, the kitchen, this vital, sacred space of nourishment, was viewed primarily, sometimes exclusively, as the sole domain of women.
That model is just, it's broken. It's profoundly unfair, obviously, but critically, it actively contributes to the problem we've been discussing.
Yeah, so.
Well, think about it. If only one person shoulders the burden of a complex, necessary daily labor like feeding a family, what happens?
They get exhausted, overwhelmed.
Exactly. And then they inevitably, understandably, turn towards outsourcing and convenience simply to cope. It becomes a survival mechanism, not a choice made freely.
So the call for equality in the kitchen becomes the absolute foundation for this future focus. This is where the revolution truly begins.
Both genders, all adults in the household, must take equal responsibility for the kitchen. And this isn't just about, making a chore chart.
No, it's much deeper than that.
It's about fundamentally reshaping our concept of family responsibility, of shared dignity, of societal equality. It's a foundational step towards a genuinely more equitable society, one where roles are based on mutual respect, shared purpose, and practical necessity, not on centuries-old, frankly obsolete, gender norms. Thank you for joining us on this deep dive. We hope it gave you some food for thought. We'll talk to you next time.